I'm Dr. Milan Moore, a joint replacement specialist with Olympia Orthopaedics in Olympia, Washington. Today, we will talk about an essential topic for our patients, deep vein thrombosis, which I will refer to going forward by the more common term, DVT. First, let's understand what DVT is and why it's relevant to you after joint surgery. Deep vein thrombosis is a condition where a blood clot forms in the deep veins, usually in the legs. It is a potential complication after total joint surgery, but with the right knowledge and action, we can prevent it effectively. Certain factors increase the risk for developing DVT after surgery. These may include a history of blood clotting disorders, a previous history of DVT, obesity, prolonged immobility, and age. However, it is essential to remember that anyone can be at risk, so awareness is the key. Early detection is crucial in preventing complications. Look out for pain and tenderness in your legs, particularly in the back of the calf, the knee, or the thigh. You should look for swelling, warmth, or redness in the affected area. But remember, it's also essential to monitor both legs for any changes because even the non-surgical leg can have a DVT. Be aware that some degree of swelling and some degree of warmth in the leg and in the knee, particularly after knee surgery, is also very common, even in the absence of DVT. Now, what can you do to reduce the risk of DVT? First, and perhaps more importantly, take the anticoagulation medicines that have been prescribed by your provider and by your surgical team. These are commonly referred to as blood thinners. For most patients, this will be an oral medication, and most commonly this is aspirin, taken either once or twice a day. Now, I find that many patients do not regard aspirin as a medication, but it is in this case, and it's very important to take if your team has directed you to take this after surgery. Studies have indicated that aspirin can have a tremendous effect in lowering the risk of DVT. Other patients, particularly if they have other risk factors, such as a history of being on anticoagulation medication in the past, may be prescribed such medications as Coumadin or Xarelto, or even injectable medications to help prevent DVT. It's important that you follow the instructions that have been given by your own surgical team. Secondly, you should perform the exercises that have been prescribed. These improve blood circulation in the legs, and they address one of the most common risk factors for DVT, and that is stasis or immobility. Third, you should walk regularly after surgery. It helps prevent blood clots and enhances your functional recovery after joint replacement surgery. Fourth, you should elevate your legs while sitting or resting to reduce the swelling. Ideally, you're able to elevate your legs above the level of your heart. Finally, if your team recommends compression stockings, you should wear those. Maintaining a healthy lifestyle post-surgery is crucial. You need to quit smoking, you need to manage your weight, and you need to maintain a healthy diet with adequate hydration because all of these contribute to better overall health and reduce your blood clot risk. Drink plenty of fluids after surgery. These not only stimulate your kidneys to release retained fluids, but they also help you to prevent constipation. It's essential to know when to seek medical attention. If you experience persistent leg pain and swelling, you need to call your healthcare team. Be aware that swelling is common in the operative leg after hip or knee surgery. If you experience sudden or persistent shortness of breath or chest pain, do not hesitate. Call 911 immediately. Do not ignore these symptoms and do not wait for them to pass. Keep your emergency contact information readily available. Reach out to the provided emergency contact if needed. Your safety and well-being are our priority. To conclude, remember to be vigilant about DVT symptoms. Follow preventative measures and seek help promptly if necessary. If you have any questions or concerns, don't hesitate to ask your healthcare team. We're here to support you throughout your recovery journey. Thank you for watching, and take care.